So basically what I have prepared for you, some agenda items, and I would like to share with you some ideas where we are in the Dubai health economy and how we are trying to utilize some of the great potential that blockchain has. And if you're an investor, look at this as a potential for opportunity. If you are a healthcare provider, you can look at some of the strategy and plans that we have in Dubai Health Authority. Just out of curiosity, who's here from a healthcare provider facility? If you put your hand up. Clinics, hospitals, hospitals, we got two, excellent. Insurance companies, anybody from the insurance company world? No one? Nobody? Excellent. Anybody from the pharma? Pharma, excellent as well, pharma, excellent. So the rest are mostly technology and consultancy. Shall I put that together? Technology and consultancy? Perfect. So the idea is just giving you some roadmap of where I am actually taking you today. Thank you so much for the introduction. I appreciate that. So what I wanted to show you here is that the areas that I tried to cover mostly, if you look at some of the entities that I worked with in Saudi Arabia, Qatar, UAE, there's a lot of, Bahrain, there's a lot of synergy in the way they're transforming healthcare. But what I want to show you today is, first of all, what's healthcare going to be transformed into? Where are we going with healthcare? And that's why I want to first start with a publication that is available online to show you the four major areas of transformation in healthcare. And this is a publication by PwC that has been recently issued end of last year, beginning of this year. And they are looking at four areas of transformation: robotics and human transformation, digital transformation, looking at consumerism in healthcare. We're also looking at the transformation in the business model, the reliance on data, and then finally the relationship between the patient and the clinicians. These are all headings in healthcare that are trying to kind of drive us into something called value-based care. If you notice in the title, I just take you back, I put something called transforming into value-based health economy. This has been the overall agenda or objective for taking us from a fees-driven of service for fee for service to outcome-driven fees and outcome-driven reimbursement model. And the reliance on data is very huge in this transformation. So today, we'll start with an introduction section. Again, looking at other publications, we also have another publication that came out of McKinsey in the area of consumerism, how digital is actually transforming patient behaviors. And all what I'm trying to do is set up the scenery for you in the healthcare globally, and then I'll drive you down into the Dubai health landscape. Again, the reliance on digital tools and wellness applications, the amount of data that we are gathering is humongous, and the on-premise storage mechanisms might have to be transformed in the near future to move into either cloud-based, blockchain-enabled mechanisms. And that's where the area I want to take you to. So let's look at this slide. In the investment banking and the banking sector in general, they have been spearheading the drive towards blockchain adoption. And this is in a publication by Accenture where they're looking at how this will drive cost reduction in the banking sector. And I want to show you what healthcare industry always look out to try and see how we can bring in more information, more adoption mechanisms, more techniques to try and reduce our cost, improve our quality, and enhance the experience. Those are what we call the quadruple aim, what we hope for. Better healthcare quality, lower cost, better patient experience, and finally physician and staff experience is what we also try to improve in the advent of physician burnout. Let me take you to this news update. This came in yesterday. I don't know if you picked up the booklet. I don't know if you had a booklet that you picked up from this morning's session. How many of you attended this morning's session with Smart Dubai? Anybody? You have some booklets. It's online, by the way. It's available online, and there's a link. And this came out of Smart Dubai. Smart Dubai is one of the Dubai government entities that are trying to help us at Dubai Health Authority to obviously engage with latest technology, specifically blockchain. So they are looking at a case study, a use case with us, specifically using blockchain technology in the licensing system that we are implementing to offer licenses to professionals, physicians, surgeons, clinicians, and whatnot. Yesterday there was a very good panel at the end of the day with a guy called Walid Al-Duhuri, who's the head of our business applications department in the IT department in DHA. And he's actually, he gave some insights about the publication. I will show some also publicly traded documents on that initiative. Again, it's a very good pilot that we are trying to build upon in order to maximize the utilization of blockchain. Right. If you look at this in page 6 in this document that came out yesterday online and it's available today, in page 6, these are some of the, I don't know if, have you seen this? Anybody see it? Anybody had access to it? It's online. It's also today, it's paper-based and it's available. It's a hidden treasure. Okay? So what I want you to focus on, and I'm going to help you a little bit here, if I just get your eyes focused on this little line. If you cannot see it, I'm just going to push the button one more time and it zooms in. So basically the idea is healthcare, there's high potential for blockchain in the area of the records and the data data collection that we have. We have a huge amount of data. By the way, every cancer patient at the moment in DHA, we have around 1 terabyte of data for an average cancer patient we have at the moment in Dubai. That's just an average amount of data we are collecting for a cancer patient. At the moment, our e-claim system, we have a unified claim processing system in Dubai that has tons of data that we are still in the process of optimizing, stabilizing, authenticating, and kind of get all the gaps fixed with the lack of data in the demographics area, making sure that we get rid of the duplication. But there's a huge amount of data that sits there, and we are even looking at the interoperability of this data. Again, the word interoperability should immediately, link up with blockchain. That's one big headache we have in healthcare. So the prevalence of blockchain in healthcare when it comes to data and electronic medical records and connecting silos of EMRs and HIS is very high. There is obviously the other assessment they have done, and on the right hand side or in the left hand side, I've put some sample applications that we have been researching for the last 2 years as we've been launching a lot of projects. One of the 3 biggest projects we launched in Dubai Health Authority, you remember those ones, huh? You have to remember them. One project called Qiyas, which is the Dubai Health Facilities Performance Framework. And this is a unified platform dashboard that we can collect a lot of quality indicators from all the healthcare facilities. These quality indicators are split into 5 different categories. One is the operational indicators, clinical indicators, financial indicators, patient experience, and patient happiness, patient satisfaction. So those are the 5 indicators. A huge project, it's called Qiyas, is going to create a huge dashboard. We're working with a vendor at the moment to establish this phase 1 dashboard. That's a big project. Another project we are working on is the Dubai Unified Medical Record, the HIE for Dubai. A very important project that we are trying to see how we can implement blockchain and utilize blockchain in the interoperability scenery. And the third project is actually our revamping and re-implementation of our healthcare professional licensing system for all the physicians. We have over 30 and clinicians, over 30,000 clinicians that operate in the private sector and the public sector in Dubai, and they are all their data sits in one database. Again, there's a huge prevalence for your investments in blockchain. So we zoomed in. I'm going to show you another article. Having been involved in a committee that has been established on a federal level to detail and flush out the healthcare data law that is coming very soon, I think you need to be aware of this as you are trying to come into the UAE or you're looking at pilots. We have the healthcare data law, an article that has come out to describe some of the areas that the data protection law that is coming out will look at, specifically looking at the segregation of the data sets, demographics, clinical data, anonymized versus de-anonymized data, and how we can actually maneuver data. This is a huge shift in the direction of HIPAA and GDPR, and it's going to affect us all. Specifically, if you are trying to implement blockchain technology and you are trying to look at our siloed databases and trying to make sure that we connect and silo systems. We have a lot of that. I'll come to that a little bit later as to describe as in for the system itself, and I'll get you an understanding of how the healthcare landscape looks at in the UAE. So let's look at some facts. This section will highlight some of the facts that we are living by. Leadership vision is very big. We have a bar that keeps rising, specifically when we try to innovate and drive excellence in healthcare services. Again, one of the most important aspects that has happened this year, His Highness releasing the 50-year charter, and one of the articles in the 50-year charter is called the Doctor for Every Citizen. So how do we actually take the services and put it at the fingertips of the patients? There's a lot of direction to actually bring in more technologies such as telehealth, blockchain, AI, and the use of mobile phones and the mobile and the actual apps, the API platforms. How can we actually bring in healthcare down to the citizen level and the resident? So again, this is the leadership vision that needs to be translated into somewhat of a strategy that can then adopt some of the major technologies. Another area that we are also living by in the Dubai government is the concept of paperless government. So the use of blockchain has been advised or has been brought to our lab to actually drive more paperless processes and bringing in more implementation of automated processes within healthcare. Smart Dubai has been a key driver to try and implement this across the whole Dubai government. So based on this, what we are trying to do, we are looking at the Dubai blockchain strategy, and as a healthcare entity, we are defining what are the use cases that we can start with. One of the areas that we are looking out for partnerships in blockchain is the e-prescription use cases. The interoperability project that we are working with, we are building consent registries and provider registries. We're trying to see, can this be built upon a blockchain instant, perhaps, where those registries would feed in from different applications. So we are aligning our Dubai Health strategy to the blockchain strategy to see where blockchain would actually provide us some use cases that can accelerate the implementation. So it's very important that you also get visibility of Dubai blockchain strategy online, which is available online, by the way. So how do we actually line up all our important directions, visions, plans into the blockchain arena? So we have a Dubai Health Innovation Strategy that was launched last year. We have a digital transformation smart strategy that was also launched last year within Dubai Health Authority. We have a strategy that we are working on to actually map to the new innovation. It's called the Medical Education and Research Strategy that will also look at the utilization of blockchain within the medical education field. So, and the creation of medical education registries. Another area we're trying to look for innovation in. So I'm using blockchain and innovation interchangeably. So you'll see me referring to blockchain as one of the technologies that our innovation strategy is focusing on. Okay? So what I show you is a high level from leadership down to the, to the industry level strategy. And then I'm kind of trying to dive into some of the major areas that we are focusing on when it comes to blockchain. This is just a fact or a fact sheet. Where we are in terms of healthcare. We have a growing population. We have a very diverse population. So when we are transforming healthcare into value-based care, we are always looking at, for example, chronic disease management. We're looking at elderly care and geriatric care and the use of innovation to try and drive better care for that segment of the population. We're looking at a life expectancy that is growing. We're looking at a population of Dubai that consists of 90% internationals, over 200 different nationalities in Dubai. So this is what we are playing with, a very dynamic economy and a very dynamic city in terms of the diversity of population. You're gonna point the time for me, right? I can talk for years, so you're gonna keep me right. This is just the landscape vision. Where does Dubai sit in the healthcare landscape in the UAE? UAE is divided into 4 different health systems that talk to each other, somewhat independent. Abu Dhabi has the Department of Health, or what we call here, the old name is called HAD, H-A-A-D, Health Authority Abu Dhabi. Now they've changed it to the Department of Health Abu Dhabi. They regulate Abu Dhabi health system. They are predominantly public sector dominant, and now they are shifting into the private sector, so it's 50-50. Dubai has 2 healthcare regulators, inside the free zone and outside the free zone. Some of you have already visited Dubai Healthcare City. They are the regulator within the free zone, and they regulate mostly the private sector. Dubai Health Authority, where I come from, is actually regulating and operating hospitals outside the free zones. So we actually regulate and operate. We have Saha, which is the second, I think, Saha sits somewhere in the middle. It's a provider of healthcare in Abu Dhabi, and it reports to the Health Authority of Abu Dhabi. We also have payers, huge payers like Daman, Saada, and we have a huge private insurance market in Dubai. Over 60 different insurance companies and TPAs in Dubai alone. And each insurance company is trying to build upon their huge data repositories. So they are actually investigating blockchain technologies, big data technologies in marriage with AI as well. Okay, so it's a very diverse healthcare system. Abu Dhabi and the Northern Emirates actually under the Ministry of Health and Prevention, who's also regulating and operating hospitals in the Northern Emirates. Just as a reminder, do you know how many Emirates we have in the UAE? For the new folks, 7 Emirates, right? 7 Emirates. The capital is Abu Dhabi, the commercial capital, the New York of the UAE is Dubai, even though Abu Dhabi can be called the New York, right? And then you have the Northern Emirates, Sharjah, Ajman, and so on. So 7 states, right, with a federal system on top, right? So far, so good? It's a huge health system, by the way, for 10 million people, huh? We have around 3 million in Dubai, another 3 million approximately in Abu Dhabi, and another 3 million and to 4 million in the Northern Emirates, roughly. I'm just giving you rough estimates. So the landscape of healthcare shows that the investment is completely diversified. So Abu Dhabi, Dubai, and the Northern Emirates health systems are actually driving the use of technology, specifically use case studies in blockchain. We are working on 3 major projects on a healthcare landscape in the UAE. We are working on a unified medical record in Abu Dhabi, which is a huge health information exchange. It's called Malafi. I'd love you to go into there. They already started putting the governance together. Dubai is also working on the health information exchange for the Emirate of Dubai, connecting the private and public sector. The Northern Emirates under the Ministry of Health is also working on a huge interoperable project to connect the private and public sector. It's called the NUMER, National Unified Medical Record. So 3 major HIE projects that actually they want to accelerate. And the concept of blockchain is very attractive to try and see how we can put the instances of private blockchain networks and connecting different hospitals. Again, I'll just show you that some of the areas we're looking at in here is, for example, patient-centric care when it comes to unifying medical records across multiple hospitals. Supply chain and the concept of how we can connect our supply chain repositories and actually and the transaction between them. We are also looking at revenue cycle management, the reimbursement models, a huge big space of blockchain potential. So again, the 6 major forces in healthcare in the UAE that is shaping healthcare in the UAE are obviously the diverse demographics, the huge data repositories that we are trying to work with, patient experience and the fact that you are able to work with a digitally mature population, growing private sector. We have a huge payer sector that is coming into the industry. There's also the farmers that are trying to obviously use more technologies to look at clinical trials and whatnot. The concept of medical tourism and the areas where we are expecting a lot more visitors during the expo next year, a huge databases of information that is actually being built. the care anywhere and the concept of connecting medical records across different private and public sectors, and obviously the area of wellness, where you actually can and drive prevention out to the community. So this is a few areas that we are working with at the moment in the Dubai Health Strategy. E-health, as I said, digital health. As we digitize, we are moving quickly and into the area of driving the maturity of digital transformation across the private sector. So we are looking at, for example, in Dubai we have 3,000 healthcare facilities, from which 30 or 40 are hospitals. And most of these 30 hospitals are private sector. So we're trying to drive the digital maturity across the private sector in order to prepare them for the integration with the public sector. Another area where the private sector is looking at blockchain to try and integrate. They always work with us in terms of looking at some of the case studies we're working on, specifically how this would help them automate their processes. So AI, we have an AI government entity, a ministry that we are trying to obviously map to, and there is definitely a lot of work in how to actually, blockchain will facilitate more algorithms to try and contemplate the data that is sitting in those connected databases. Just to give you an understanding of how different our initiatives are from a federal level to a local state government level. So far so good. Are you still awake? You're good, excellent. Is that a lot of information or not good information or okay information? It's okay. So this is the exact case study that was shared with you yesterday by our IT director, or the head of business applications in the IT department. It's basically an MOU that was signed between the Dubai Health Authority that regulates outside the free zone and the Dubai Healthcare City, DHCC, that it regulates within the healthcare free zone. And the idea is to connect professional licensing systems inside the free zone with outside the free zone using a blockchain instant, right? To authenticate the certifications of the professionals, looking at how we can pass information between the two licensing systems. As I said, within DHA we have over 30,000 professionals that are actually licensed, and I'm talking about physicians, nurses, ancillary staff, right? And they renew their licensing system on regular basis. And it's automated within a system called Shirian. So Shirian is being now upgraded, and a blockchain capability on a use case has been added. That's what was the concept of the panel yesterday. If you want to know more, come and talk to me afterwards. The other area that we are looking at, obviously, we've just launched a huge smart system to book doctors. It's an app that is called DubaiHealthBooking.com. They want to make it look like the hotelbooking.com, right? And the idea is they're gonna investigate instances of use cases that they can implement within using the blockchain available capabilities within Smart Dubai, or our partners in the telecom companies, or even in any private providers, to try and see how the data can actually be transacted between different systems. Patient satisfaction, patient complaints, licensing system. And this is a very important app that has been launched only a month ago. Again, it's already out there. I've been talking about Dubai Health Strategy so much, but you haven't seen it yet. I'm just going to give you a glimpse because I don't want to cause you a headache with it. It's available online. If you just type in Dubai Health Strategy 2021, you'll see a beautiful document. For 10 minutes? 10 minutes? Excellent. I'm almost finishing. So, and there is another document that I would like you to see as well. It's called the Dubai Health Investment Guide that has been published. It's also available online, 2018. Go ahead and look at it. It gives you the areas that we're trying to look at investment, whether it's from a clinical perspective or a technology perspective, specifically looking at blockchain, AI, and some of the similar technology. But this is our strategy: happier and healthier community. And the three major goals we want to look at is population management. We're looking at obviously driving services and technologies and the use of data platforms on how do we actually automate our services, and then changing our governance, how we bring in innovation in the way we govern healthcare, and that's across the health system in Dubai. And the idea is we have around 15 different strategic programs, from which a lot of them actually are looking at use cases within blockchain. And I'm going to drag your attention to the lower part, where you look at the medical informatics and technology program and the health finance and insurance, where we're trying to connect our e-claim platform and looking at authenticating some of the data that we have with the other databases that sits in the private sector. These are some of the major gaps that we are looking at to address within the health system in Dubai. The idea is it's a big strategy, it's a lot of projects. Blockchain pops up in many areas and always we're thinking of use cases. So as I said, the first use case we are implementing is with the licensing. We're thinking about e-prescription. That's another area, the prescription of, the dispensing of prescriptions. We're also looking at, for example, the registries, the consent registries and the provider registries within our health information exchange. And how do we actually bring in some of the use cases to blockchain. But I want to show you, or I want to finish with these few slides. The governance of blockchain always comes out with, obviously it's connected to the data law that we are trying to work on. So we have a federal data law that is coming in, and we always have to think about where we are going with health system. The driver of the use of data and how we store data and how we transact data comes from this slide. Healthcare, and I'm going to step on the side, healthcare is actually looking at transforming from fees for service or service for fees, fee for service to fee for outcome. So you want to make sure that you pay our health system providers actually according to the outcome, to the quality of the value they provide. And the whole area we're working on to transform our health system in Dubai from a fee for service to a fee for value or outcome rotates around these areas. How do we connect with our payers? How do we actually bring in technology to actually guard the data, store the data, transact the data between the silos that we have created? And as I told you, health system in Dubai consists of 80% that is a volume that is controlled by the private sector. So we have a lot of facilities that haven't achieved the digital maturity enough to integrate with the unified medical record that will be established soon. We have a lot of concepts when it comes to the different programs, whether it's urgent care, chronic disease management, and women health, that requires huge data fluidity and data analysis. And this is an important concept that we are looking at. The other area is how do we balance, how do we actually govern the data that blockchain is allowing us to move from one area to another through and create policies. How do we work with pharmaceutical companies and pharma industry to actually promote clinical trials and feed that into our ecosystem? The benefits are potential, but how do we regulate it? That's another area that we need to think about. From a consumer perspective, balancing consumer safety and the investor attractiveness is a very touchy point, because we have a huge industry that is growing, a number of facilities that are being built, and a number of facilities that are being optimized through the digital transformation and the use of technologies such as blockchain. And finally, the customer satisfaction. How do we create, there's a lot of apps that are actually being created and at the fingertips of the patients. How do we actually, do we have access to that data? Do we actually store the data within the borders of the UAE or within reach from us? How do we actually reach out and transact with that data, those data silos? Another area to concern ourselves with. And with this, I think I just want to thank you for your time, and I hope this was useful. It's very heavy in terms of information, and I hope it was useful to you. The idea is connect with me. I'm on LinkedIn, but I just want to leave you with a funny quotation. Normally they say you gotta connect, or there's no romance without finance, but there is no information without connection. So far, so good. Thank you so much.
Are patients able to see, normally when you go to the doctor, a doctor scribbles down on a piece of paper, hands it to you, you don't even know what's written there. Sometimes you're never told what's going on with your body or what ailment you're suffering from, and you just go to the maybe clinic and chemist, and they dispense some medication for you. Are you able to see or track whatever is going on with you, or know exactly what you're suffering from?
So, very good question. So at the moment, all our prescriptions in Dubai from a provider side to the pharmacy is actually done online. So we managed to connect our private sector facilities with our pharmacies, the retail pharmacies, online in a matter of years. Obviously, it took us years to get the automation on. And that's what we've been working on for the last 6 to 7 years here, is how you kind of automate these processes. But at the moment, to answer I will add a caveat on your question. All these transactions are done through integration engines. We use, for example, Rhapsody from Orion Health to actually transact between the pharmacy database and pharmacy systems and the provider systems. And we use this platform, which is an e-claim claim link, to actually get our claims automated, and hence allowing the prescription to flow automatically or electronically. So to answer your question, yes, we are working on to removing that paper and that scribbling, and in the US they say the most dangerous tool in a doctor's hand is the pen, right? And we're trying to move into there. However, the automation is being done sporadically. So the Dubai Health Authority has been automating their facilities. The private sector hasn't been mandated to digitally transform yet, but it's coming soon, and some of them are actually spearheading that. Does that answer your question? In terms of the removal of the paper and the scribbling of the doctor? Yeah? Question?
Here, I have a question for you.
What are you? Can I know your name, your organization?
Yes, my name is Tariq Jamal. My organization name is First Global Consultants from Toronto, Canada.
Nice.
So question here is, I can see the entire blockchain in the healthcare industry can have two very fundamental sides. One side is the patient-centric. The second side could be facility-centric, right?
Okay.
So what's your first objective? Are you trying to accomplish both together, or is it going to be more on a patient-centric? Reason being, if the healthcare here is 80% privatized, then obviously from one facility to the other facility, they don't have no connection. The only connection or common denominator here is a patient. So patient will have some kind of smart card, so they can see that I have certain treatment at facility A and certain B, and they can give a permission to facility B to see what's being done on facility A and vice versa. So how do you see it? Are you guys trying to, what's your strategy looks like? It's going to be focusing on patient-centric first and then facility, or together?
So basically, the strategy focuses on, first of all, the quality of care. So we need to show or find a way to measure quality between all the different facilities from an operational perspective. How are they actually providing those services? And then from a patient perspective, from a satisfaction point of view, how are the patients are actually getting satisfied? Are they happy with the services provided or not? So we're looking from a strategy perspective. The vision is happier and healthier community. Very clear. The vision is of the strategy. If you look at the mission says that we're transforming Dubai into a world-class health system, right? By actually utilizing innovation and driving excellence in the services to connect communities. So the idea is you're actually looking at first of all, the quality matrix to try and measure your facilities, but at the same time, one of the major pillars that you're actually looking at when you look at the quality is patient safety and patient satisfaction and patient experience. So the patient centricity is embedded within the strategy. How do we achieve that? Is through innovation, through integration of services, especially looking at our care model. The silos that are existing at the moment, a patient cannot see what's happening in facility A and facility B. He's either going to go and print out the documents in facility A and go to facility B, get it printed again, and that's the only way the patient will have access to the data. There is no way now that the data is at the patient's fingertips. Does that answer your question?
Yeah, I guess the main fundamental difference I see in the Middle East implementation versus North American is over there is more about patient privacy, permission is the key factors, and then they draw the what they call quality matrix out of this whatever's being shared, right? And here probably it's more like a governmental control. So they say, okay, let's focus on quality first and then worry about the patient privacy.
But I think lumping up the whole Middle East, you're talking about different health systems. Saudi Arabia, Abu Dhabi.
Okay, maybe Dubai.
Even the UAE is 3 or 4 different health systems. The direction is patient centricity.
Okay.
And now if you look at the federal healthcare data law that is coming out,
Yeah.
and this is our patient privacy law.
Right.
There's some other countries that have already superseded us. Saudi Arabia has been already doing a lot of work on the patient privacy law. In Dubai, for example, they started now focusing on the patient privacy law because of the huge digitization drive, specifically in the private sector.
Okay, we are thinking about issue patients a coin to contribute to the or share their information that can help the R&D, because obviously the companies who are performing R&D, they get benefit from the information. So patients should, being a contributor to this R&D, should be get benefit from through some kind of healthcare coins or something that can help them pay for their services. And just a side note.
So that's been discussed now in the healthcare data law.
Right.
And actually the segregation and the segmentation of the data. What can be anonymized, like clinical data, there are discussions now to allow that to be available for research by the consent of
Exactly.
the patient. So the definition of the consent mechanisms and what data should be shared for research and what is being defined in the federal law as we speak in the UAE healthcare data law.
It's very good to know. I did lots of cases in Oxford blockchain course, so this is one of the important one for me to know. Thank you for your answer.
My name is Ilham Aziz Anwar, so thank you for the presentation. I'm currently doing my master's in blockchain for clinical database management system for clinical trials. So according to the all papers being published, the limitations of blockchain is scalability and not knowing the cost. So how is the Ministry of Health counteracting this limitation? Because according to all the researches that I'm doing for clinical trials, HIE is impractical as of now and even maybe 2 to 3 years to come because of the scalability issue.
Sure.
Blocks have limited size and you cannot put all the electronic health records in them.
That's right.
So
that's right.
how are you tackling this?
I think that's a very good question. So what we're doing at the moment, we're looking at benchmarks. So we haven't yet, because at the moment the establishment of the HIE is going to be going through the traditional way, mostly on-premise data centers or through a cloud-based a cloud-based storage mechanism. And that is going through the traditional ways, using an integration engine, because the blockchain capability hasn't been yet tested, as you mentioned, in terms of the scalability, the immutability of obviously the records once it goes onto the blockchain. We haven't yet actually strived into applying that directly into the HIE. So we're still in the testing phase or the exploratory phase to see how do we actually bring in. So we're looking at use cases. So we might look at, for example, the blockchain to look at a factor of the e-prescription space when it comes to the HIE. It's not going to be the whole data repository exchange or the data exchange. It's going to be looking at simple use cases and then testing it out to see could it be scaled up or to a certain limit, and could it actually be affordable from a data perspective and from a fee perspective.
Okay, so I have a follow-up question to this. The thing is, if we add a lot of data to the blockchain, it becomes slow.
Okay.
So the amount of transactions per minute becomes impractical compared to, for example, Facebook's transactions and credit card transactions. So if we were going to resort to a solution that's going to make the system very slow than it is now, then why are we doing it?
Fair enough. And that's a very good point. At the moment, blockchain is not considered in any of the 3 major projects, whether it's Abu Dhabi, Malafi, or Dubai, the Nabit project, or the Ministry of Health, Numer. At the moment, it's still in the piloting phase to look at use cases. So it's not actually going to be a massive scale in terms of put all your HIE on a blockchain. Because at the moment, there are public blockchain instances, and we are working, for example, with the like of Smart Dubai that are using they're using the IBM blockchain, public or private. They're looking at the public and private Hyperledger, private and public offering. They're also working with, for example, the telecom companies that are actually providing some sort of partnerships like Etisalat and to see what can we do when it comes to the, using blockchain as an HIE platform. At the moment, it's still investigation stage because as they want to accelerate the connectivity between the hospitals, they will resort to traditional methodologies.
So, one last question. So basically, would it be practical to say that it's a strategy for 2021? Because 2021 is just 2 years from now.
So when it comes to our Dubai Health strategy itself, 2021 is mostly being, at the moment we're going through a refresh. So as the content of the strategy, when it comes to the clinical aspects, yes. We're looking at, for example, clinical strategies when it comes to moving primary care into more integrated model. From a technology perspective, it's being revised constantly. So we're going with the HIE in Dubai as part of the strategy based on the HIE technologies that are already in existence and tested, the ones that you can scale up. Blockchain as a strategy mostly is looked at in a piloting phase. So it's not an actual scale-up full implementation. The paperless strategy that we are working with in the Dubai government does indicate that blockchain should be the unification or the unified. That will obviously might not meet the target by 2020 because the blockchain strategy is 2020. It might be revised and pushed a bit further because of they're still investigating. We're investigating to put all our processes. We're still using a traditional ERP system within DHA, 13,000 employees. We're still using a traditional storage mechanism for our licensing system. We're probably going to use our electronic medical record at Dubai Health Authority is based on an on-premise data center. So blockchain is just being tested. But yes, absolutely, it probably needs revision.
Thank you, Doctor.
Hi, good morning. My name is Dr. Siddiq Mohammed. I am the founder of a European Digital University based in America with the slogan Empowering the Universe with the Blockchain Revolution. Okay. So, my question is, you are totally focusing on Dubai Health, I think. So, will you be extending your technologies or ideas to other nations also like India or Canada? Because we are coming with a lot of blockchain summits in different parts of the world. So can I expect your support for that? Any kind of guidance? I think you are based in America, I think.
I guess that will go on base by base cases, or case by case basis. Base by base cases. Okay, case by case basis. So basically, at the moment, there's a lot of in-traffic coming from technology companies and blockchain startups into our Dubai Future Accelerator. Our innovation center at Dubai Health Authority is actually bringing in a group of startups from the world inside Dubai. Going outside is actually, it depends on how much research is actually infrastructure do we have to push some of the technologies that are created in and then pushed out, or commercializing some of those entities. There is a company that was created in Abu Dhabi called Malafi. And Malafi.ae is a company that is looking at establishing an NHIE in Abu Dhabi and using some of the technologies to try and commercialize it later on once it's implemented and then issue it outside the borders of Abu Dhabi. Again, this is an idea between Injazat, it's a PPP project between Injazat and from Mubadala and Dubai Department of Health in Abu Dhabi. These are the kind of concepts that are being now created. PPP models, creating companies commercializing technologies that are implemented outside the borders. From a startup perspective, we're getting a lot of in traffic or inwards companies to come and exhibit, to come and live through the startups and the accelerator and incubator programs. But I think there will be some time that will be, a two-way traffic where you have, once we have the research infrastructure and capabilities to actually promote inventions, promote, for example, startup companies to go outside the UAE, that would be a great idea. For now, it's going to be case-by-case basis.
But are you, any companies from outside, like USA or Canada or any company, if they want to do something with the Dubai Health, is it possible that we can participate in any of the program? Because it's a new technology,
Sure.
so still a lot of research.
So my advice to you is threefold. Number one, Dubai Health Authority has around 13,000 employees, around 100 different departments. You need to look at a case study you want to promote and find that sponsorship within the Dubai Health Authority department. Number one. Number two, you got your future accelerator programs. If it's a startup company, it can come through those accelerator programs or through the innovation center within the Dubai Health Authority. Number three is find a partner. For example, there are telecom companies, insurance companies that are willing to bring in some of those actually technologies in, and they can actually come into the Dubai Health Authority and work. So there are multiple ways they can actually bring in technology. If you're asking me how to penetrate the market, there are definitely those are the three advices I would give. Does that answer your question?
Yeah, okay. Finally, my last question: how America is seeing this blockchain technology? Are they adopting all these latest technologies of block? Because I heard a lot.
I think that's a very good question to the delegation. That is actually, we have a great group from Atlanta that are actually bringing in some of the know-how when it comes to how blockchain is adopted. If you ask me about our benchmarks and research, what we're doing, we're reading there is a lot of publications in terms of the possibilities of using blockchain in health information exchange, exchanging data records or medical records electronically between hospitals. Again, the issue will be scalability. As the lady said from the university, there's a lot of unknown, I'd say, limitations that cannot be replicable within healthcare systems. So we're looking at that. We're reading one of the biggest major reports that Deloitte issued about the utilization of blockchain in healthcare, and they were funded by the US government to research the use of blockchain within healthcare. And we're reading that report constantly to try and understand how can we mirror and marry some of those concepts and try to see where should we pilot. Because don't forget, blockchain here still in the piloting phase. Scaling it up to a full-scale platform is still under investigation. So we are getting a lot of publications from the consultancy world that are looking at blockchain capabilities within healthcare. We're working with startups and companies that are actually coming from the US, from different backgrounds in the US, and they're trying to kind of spearhead some of the blockchain applications by trying and exhibiting some of those capabilities. So we're still getting a lot of info to try and see how we can investigate the use of blockchain. Now, one of the areas we're looking at, the e-claim processing platform. We want to see how can we actually bring in blockchain into one section of that, just to see how would that speed up. Would it speed up the process of transacting claims? Would that actually be able to safeguard it from a cybersecurity perspective? Would it actually enable us to track the transactions? Because again, there is some, as I said, we are getting to know more of the limitations and how we can go around those limitations to try and apply it in the healthcare.
So finally, we are working to set up a blockchain research center in the University of Dubai in collaboration with my university, giving PhDs for blockchain.
Very good.
So may I know your advice for which is the best?
I think you should come and market in such platforms to actually come and market your offering and services. What my advice is, do actually build your network, do actually come in and see if you want to look at our medical education and research department, see what they actually be interested in to try and partner or pilot or and Dubai University, you said?
University of Dubai.
University of Dubai?
Yeah.
Again, that's a good platform to actually penetrate the market and see how we can actually...
Today the chairman of University of Dubai is coming here. His
Okay.
name is Dr. Isa Bastaki.
Fantastic.
So he's going to come, and we are giving people from all over the world.
Perfect. Should have a booth, huh?
Yeah, we are working on
Very good.
Yeah.
So you give 5% to the organizers, right? You're marketing your tool now. Commission.
Sure. Thank you.